Today we have a guest on the show, and I'm glad to be welcoming Dr. Beate Setzer. She is a practicing general practitioner. She's graduated from Wits University in 1986, did her internship in 1987, and she has some experience also practicing in the UK. Dr. Setzer contacted me through Des Bernardo, or I think it was maybe even Reino de Beer, who gave you the number. Reino, we must talk at some point. And she contacted me because she was very concerned about what she was seeing in the last few months and wanted to speak up about what was bothering her. Dr. Setzer, very welcome to the show.
Thank you.
So when you first contacted me, you said that you, early on in the pandemic, you, like everyone else, were very concerned and you followed what the government and media was saying, and you thought it was very serious. But over time, you became concerned. And tell us a bit how your concern started and what exactly was it that was bothering you, and how did you get to the point where we are now?
In February, a fellow choir member came back from Wuhan, having just been in quarantine for something like 2 weeks, 4 weeks, I forget, wanting to know if we were going to get this virus here. And I said, without a doubt. I was also asked between the connection of G5 and this virus, and I said I had no opinion. Early in March, I started seeing patients or people wearing masks in shopping centers. That was before lockdown. And on the 27th of March, we were told that we needed to have a complete lockdown in order to prepare for the coming pandemic. We were told that we were going to be exposed to a deadly SARS-like virus. And we were hearing about patients needing ventilators in order to survive. The population went into lockdown without a murmur. The World Health at that time had put out a mortality rate of 3.4%, expected mortality rate. National Institute of Communicable Diseases here in South Africa put out a mortality rate of 4% at the time. So you can do a quick calculation and you can see where they come up with millions of deaths expected.
Right.
Very early on in March, I'm not sure if I closed my practice or whether I opened my practice. I think at the beginning I opened until 1 and then went home early. And there wasn't much happening. And I started getting messages of fake news. I remember 2 incidents quite distinctly. One was a picture of coffins allegedly originating in Italy, Bergamo, which was retracted exactly a minute later, saying that these coffins originated from a shipping incident and had nothing to do with COVID. The second incident that I remember distinctly was a message allegedly put out by a doctor at UCT. And my husband said, don't send on these messages. This woman said She didn't say this. She didn't put this message out. I took note. After 2 weeks, I took a step back and I thought, what is actually going on and what are we dealing with? What's the worst case that you could possibly imagine? Do we have the plague that killed millions of people in those days? No, we do not have the plague. What else would make me afraid? A hemorrhagic fever, Lassa fever or something like that? Do we have Ebola? No, obviously not. No Ebola. So what do we have? We have a respiratory virus. We have respiratory viruses every year during the flu season. So what makes this one different? We were told that it is highly infectious. We were told how it spreads. And I know flu spreads like that. And I know flu is highly infectious. We were told that asymptomatic patients spread this disease. We were told stories about this disease spreading through the gastrointestinal tract, and we were given a list of symptoms to look out for. They started testing the PCR test, and asymptomatic people who had tested positive on this PCR test were put into quarantine, and a period of 14 days was promoted. I found it strange that we would be quarantining not sick people, but healthy people.
And simply people who have tested positive.
Yes, I was not taught to quarantine healthy people. We were only ever taught to quarantine sick people. And if you look back throughout the history of the world, we have never quarantined the healthy.
Yeah.
Only the sick. This question of cases, every positive test is being labeled a case, and this is happening the world over.
That is true. And also what we've seen is in the media and also with the politicians, in the beginning, they were driving the fear that we're all going to die from this. And now we're just driving the fear of being tested positive, as if that means anything at all, when most people are asymptomatic.
Because that is the way it's being portrayed. That's the way it's being portrayed.
How hard does this make it to trust any of our numbers? Because we're now sitting with numbers that are our infection numbers are now being used to justify measures, not deaths, our infections. And on top of that, we've had so many reports from all over the world of defective test kits or contaminated test kits in some cases that were sent back. The president of Tanzania had a lot of different things like fruit and goats and things tested and got positive test results back. And there was a lot of reporting on false positives and false negatives, yet the infection number is now the number that's being held up as the one that we need to do something about. And to me, it just seems like that, especially the number of infections, the deaths are also dubious, but especially in the infections seem extremely dubious. And yet that is what we're now using as justification for all sorts of crazy measures. We still have a curfew.
It's used all over the world. If you look at the media, they are talking about cases when and they're not differentiating between sick people and positive tests. And we should be. I'm not, and I can just see what it's doing every time. If I didn't know this, I would be afraid every time I looked at these figures. I have to make a conscious decision to dissociate myself from these cases, knowing that these cases are not really cases. They're talking about tests.
Yes, correct. And also another thing I want to get to with the testing, besides the fact that we are now having a hard time to trust any numbers, really, there is also something very strange to me as a non-medical person, looking at what we're doing. We're forcing people to wear masks so that they can go buy food to feed themselves, because apparently they can be so infectious and spread the disease just by breathing on people. Yet we have to do a swab where we push the swab right into someone's sinus cavity almost to get a sample. Number one, I think that put a lot of people off from going for testing, and maybe even some people who should have gone for testing. But it also just doesn't make any logical sense. What's your opinion on that?
Well, the virus replicates in our noses, and if they're going to do one sample, it makes sense, if you're going to conserve the test, to use the sample that's going to be most likely to have a yield. So that's going to be a nasopharyngeal swab, but it's also the one that is most invasive.
Do you think that kind of invasiveness is justified on people that are not displaying any symptoms, that are not sick?
Knowing what I know now, definitely not.
I want to talk a little bit about treatments, and not so much in the context of whether they work or not, but in the context of what I know about how doctors usually operate. Because as I've told you already, my dad is a physician, and I've grown up around doctors and physicians my whole young life. In fact, as a young kid, if I wanted to spend time with my dad, I often had to go to hospital with him for hours on end. But my point is, I've seen our doctors treat patients, and they make decisions based on what they know, and they often prescribe things to patients off-label. It's not something that is completely alien and off-worldly. So specifically the demonization we've seen with chloroquine, which doesn't make sense to me at all, since it's a very widely used drug and we can only get it with prescription here, as far as I know, and it's a controlled medication. There's doses that we know are safe. There are doses that we know are not safe. We know very well what the side effects could be, if there are any, because we've got a lot of data on this drug for decades and decades. I think they said 50 years. So
that's correct, yeah.
And in many places, doctors have been prohibited from prescribing this. And that is another thing that just doesn't make sense to me. Off-label treatment is something that is extremely common for all doctors. Why are they being prevented from doing this? In some cases, patients asking for it are not being given it. Is this something new to you? Because I've never seen this. I've never seen this kind of thing before.
I'm not aware of this prohibition on prescribing chloroquine or anything here in South Africa, but I do know that they have done this in America. They have actually prohibited doctors from prescribing it, and they actually needed to reveal the diagnosis before being issued the prescription by the pharmacist. That's what I picked up on from overseas doctors.
Is there any other example of something like this that you can think of where the state makes it illegal for a doctor to prescribe something off-label?
I'm not aware of anything.
Me neither. I've never heard of anything like that. So that is why I wanted to bring it up, because
I can't think of anything. There are prescription medication and but I'm not aware of anything that is actually illegal to prescribe. No.
Right. Doctors are allowed to use their own common sense and treat patients according to what they think will work. That is how they always operate. In any event, I want to move on to...
Yes, we try and follow guidelines, but yeah.
That is true. I want to move on to something else that I know concerns a lot of people in my audience, and that is the whole issue of not only contact tracing, but also there seems to be a very big drive for much more than that. People having to carry a sort of pass, a digital pass on their mobile devices to show that either they've had a test and it's negative, or that they've had a vaccination when the time comes when we have a vaccine available. That idea is being promoted all over the world.
Correct.
And it seems strange to me that there is this big drive for a vaccine, and it does seem that there could be some intent to keep us in lockdown until it is available, and then impose what I call soft mandates on people, where they don't have to take it, but if they don't get certain of their rights back, which is very concerning to me. But in your mind, as a medical professional, does it make sense, this kind of obsession over a vaccine for a disease where 99% of people survive, and where it just doesn't seem necessary to me at all, considering how far we are through this pandemic already? Cases are, and especially deaths, but even cases are dropping off all over the place. Yet we're still obsessed with this vaccine, still obsessed about talk about a second wave of infections and reinfections. I mean, how can we even say that if our PCR tests are as flawed as they seem to be? We're not even necessarily sure how big the first wave was. We're kind of unsure about that, and now they're already talking about a second one, and have this vaccine sword hanging over our head. I saw quite early on a virologist from the UK talking. I think it was Channel 4 in the UK, and he said that this is the most scary virus he's ever seen, and that we have no immunity to it. How can we have no immunity to this if 99% plus of people survive this infection?
I saw biostatisticians online who said that Germany looked immune. It looked like the population, 80% of the population were somewhere else. They could have been on an island because they were not infected. And they were not even exposed. That was in Germany. And I think a similar thing happened here. We were told that this is a novel agent, a new virus. It turns out that this is a coronavirus, and we are routinely exposed to coronaviruses since our childhood. AMPATH routinely tests for coronaviruses on their panel of PCR multiplex testing during the influenza season. So we are definitely exposed to other coronaviruses. There has been talk about there's been talk about antibodies and how long do we develop antibodies and how long do these antibodies last. But that's not the total of our immunity. We've got cellular immunity, and there is a study out that came out in Tübingen where they analyzed blood samples from 2018, and the T cells responded. So we have cross immunity, which explains why so many people either don't show any symptoms or show very mild symptoms.
Yes, these coronaviruses are obviously all genetically quite related as well, very similar. So I don't understand how anyone can claim that we have no immunity to this. In fact, it seems that in some people who recover from this, it seems that they recovered. It seems like their cellular immunity took care of this so quickly that they didn't even form proper antibodies.
That's correct. I've seen the same thing.
Moving on from this, quite concerning to me is that it seems our regulations in our National Disaster Management Act already makes provision for forced vaccination, because if we look under Section 6 of the regulations in point C, it's, well, under point C, we get to the meat of the story, but in the beginning it says, no person who has been confirmed as a clinical or laboratory confirmed case as having contracted COVID-19, or who is suspected of having COVID-19, or who has been in contact with a person who is a carrier of COVID-19, may refuse to, and there are two other conditions, but under point C it says, you may not refuse to submit to a mandatory prophylaxis treatment, isolation, or quarantine in order to prevent transmission. Now, didn't we have major trials after World War II about experimenting on people and forcing them to take things into their bodies that they didn't want? I mean, what is this, from a medical ethics perspective, what does this do to patient autonomy? I understand that you can, in circumstances, as you've said before, where you deal with a serious disease like the plague, that you isolate people, that you quarantine them, but even under those circumstances where you are dealing with the plague, can you force a patient to take your medicine? Is that medically ethical?
No. I never do this. We're not supposed to do this. And it's in conflict with autonomy, obviously.
Yes. So what do we do about this? Because the government seem intent on not letting go of a vaccine. I mean, our president just last night made mention in his speech again of how we're going to secure vaccines for Africa and how we're going to try and establish manufacturing capacity here to manufacture the vaccines here. They really are obsessed with this. The Disaster Management Act's regulations makes provision for forced mandatory prophylaxis treatment. What is going on here? It seems to me like people have just completely lost their mind.
It seems that we are not looking at whether this actually is a disaster that would justify implementing the Disaster Management Act.
Exactly.
The way the figures are, and those figures have been out early on. We've had figures out very early, in March already. At the end of May, I put together a short summary and put that in our newspaper, the Polycare newspaper. Even then, it was known that the actual mortality rate is less than 0.5 everywhere.
Yes.
Some as low as 0.1 or 0.01, and it puts it into the category of a moderate to severe flu, which we have every single year. The mortuary which they built for 9,000 people is empty. The Cape Town International Conference Centre was closed a couple of weeks ago. We're at the end of the flu season. And even the official figures are something like 15,000 dead to corona. Well, we had 12,000 people dying from influenza last year. We had 60,000 or 62,000 dying from TB last year, and we have this every single year, not to mention HIV. So what's happening is that we're being given these figures out of context, and it's not being put into proper context so that people can actually see that this is not the threat that they told us about.
But everything seems out of context.
People die.
Everything seems out of context. Our whole response seems out of context because it's the whole hysteria. It's not grounded in any sort of reality. I mean, I don't want to talk about the Lancet too much because they don't have a really good name at the moment. But I think even in as far back as March, they made a prediction of 0.6%. Nothing is in context. Everything is overhyped. We're sitting waiting for the government and media, in my opinion. I don't know what your opinion is on this, but they are creating a perception, in my mind, trying to create a perception amongst people that there is a huge demand for a vaccine. Is that something that you see from people you talk to? Because it's not, I don't see it at all from people I talk to. I know my audience, obviously everyone will say no thank you, but I mean, just talking to people in general, it seems to me it's about a 50-50. People who are not members of my audience, who are not exposed to the same information, even then it seems to me it's kind of 50-50. So this perception to me is just not true. But it seems to me that like they're going to try and use that perception to still push a vaccine on people. And it doesn't seem like, even though they say it a lot, there doesn't seem to be a real concern for the safety of this vaccine because of the space at which everything is being pushed through. It's like quite a few people have hinted that a vaccine is a condition for us to go back to normal life, which again just makes no logical sense if you look at the numbers.
The vaccine should be, number one, necessary. Number two, it should be safe. They're currently working on a number of vaccines. The new one that they're talking about is the mRNA vaccine, which would change, or have the potential to change our genetics. It would be the first of its kind. It's never been tested before. And now suddenly they want to fast forward research to have it available next year. Side effects such as cancer, autism, chronic illness, autoimmune disease would take many years.
It is true. Things like that will take years to identify. And that is why it usually takes a lot of time to develop these things. But now we're in a situation where it really does seem like they're racing towards a vaccine that I don't see a justification for. So what are we going to do is my question, I guess, when we get to that time where there is a vaccine or more than one vaccine that gets approved, and the government does want to come to our door or say to us, if you don't take this, you can't get your normal life back. What would your response be to that? And just as a group of people, as South Africans, how should we respond to that?
We're sitting with a wave of misinformation. And we should counter that with correct information.
I agree.
It should be just those two questions. Is it needed? Is it really needed? And is it safe? Before anyone consents to having a vaccine.
Why do you think, ever since we went into lockdown, why do you think so few local doctors, because there's been quite a bit on the international scene of doctors speaking out against nonsensical things on media outlets overseas, but very few here that I've seen. But why do you think so few doctors have spoken up about this? I mean, it seems strange to me because there are just obvious things that are wrong, that are, even if you don't call it wrong, that are highly unusual and suspect.
Control from the top. No cohesion between us doctors, no freedom. Doctors being tied up in group practices, working for hospitals where policies are made, group practices where policies are made.
And I know doctors' lifestyles. Having grown up in a house with a doctor dad, I know what their lifestyles are like. They're very busy. They don't have time for nonsense usually. And this certainly falls in the category of nonsense, if you ask me. So I understand that not many of them have any interest in playing political games, but we are in a situation where the entire country was locked down, where thousands of people's lives and economic futures were destroyed. I would have expected at least a little bit more reaction, a little bit more response from the medical community, and a little bit, just a little bit more questioning of authority, really, I guess, is my point.
When Professor Linda Gray made a statement and was attacked, there was a list of something like 200 practitioners that came out rapidly in her support. But since then, we've not really heard much. I've heard the occasional doctor saying something about these measures, surface viability. One doctor mentioned surface viability is a figment of the imagination of the cleaning industry. They invented it. This was one of the professors. I don't know of any respiratory viruses that are primarily transmitted through surfaces, and I have not been able to find any evidence other than experimental evidence to support surface viability. This week there was a article, I think it came out on Medscape, that said surface viability or surface transmission is definitely overrated.
Moving forward, you've mentioned to me that you think there should be legal action happening. How do we move forward with something like that? Obviously, we need lawyers and we need attorneys, advocates, someone who can help us. But what do you propose exactly we do about this?
We need a group of people together that are like-minded that we can actually discuss this. And it would be good to have people from different fields.
It will have to be mainly
of expertise.
It will have to be mainly a meeting of people from the medical field and the legal field, in my opinion. So I think it's something we really
and economists.
And economists and actuaries. So
yes.
This is definitely something we should look at. I know I've seen some of the stuff from Panda, but I mean, they are not doctors. We really should bring all these people together.
You don't need to be a doctor. You don't need to be a doctor to be able to interpret as figures.
No, absolutely. I agree with that. But my point is we should bring these people to, what we should be doing is bring all these people together. Panda, the medical community and the legal community, people who are concerned and who can see the shenanigans going on here, because we are not out of trouble yet by any means.
No.
Level 1 lockdown is it's not the end of the road. We need to get to level 0, as I said in a video yesterday that I released. That is where we need to be. Level 0. There is no justification for any of this anymore. If you look at the numbers, national state of disaster should be ended completely. There is no reason for this anymore. And we need to bring all these people together so that we can come up with a plan. So maybe we can talk again soon, maybe next week or so. We can see what the response is from this. Maybe there are people reaching out to us and we can start organizing and putting something together. Because I, for one, and I know I've got a different perspective on this than many other people, but I am not going to just sit around and lie down and let the World Health Organization run our country through a proxy. I'm not going to let that happen and in the process have our country destroyed for a long time to come. We really do need to stand up and do something about this. But Dr. Setzer, thank you very much for speaking to me. I will have you back again anytime you want, and we can see what we can get organized, because this rubbish has to end. I'm sorry. There are obviously circumstances in which we have to be careful and have to take precaution when things are really dangerous, but the numbers are not showing that is what we're dealing with at all. So the sooner we put an end to this, the better. Thanks again very much for talking with us. I wish you all the best of luck as well. I know you're fighting an uphill battle as well to get doctors mobilized, and you've also had your own fair share of censorship and things to deal with. So thank you for speaking with us, and I'll have you back again very soon, and we can see what comes from this. Thank you.
Thank you.
Please remember to click subscribe and the bell for notifications, and you can find us in the following places.